Welcome to Robert Wood Johnson University Hospital's Health Talk. I'm Dr. Douglas Ashinsky of Robert Wood Johnson Physician Enterprises, Warren Internal Medicine. About 144,000 New Jerseyans are of Chinese descent, making them one of the largest ethnic groups in the state. This population faces increased risk for serious health problems such as cancer, hypertension, and diabetes. But due to a variety of issues such as language and economic barriers, many Chinese Americans are not getting the preventative health care services they need, or they may delay the medical treatment when health problems arise. On today's show, we will discuss the health concerns that are prevalent in the Chinese American community, barriers to the care, and how Robert Wood Johnson University Somerset is helping to improve access to care for the Chinese American community through its new Chinese medical program. Joining us today are Dr. Deborah Lue of Robert Wood Johnson Physician Enterprises Steeplechase breast specialist, and Angela Lee, who's the patient navigator for the Chinese medical program at Robert Wood Johnson University Hospital, Somerset. Welcome to the show.
Good morning, Dr. Good morning.
Since we're discussing something that's so unique, I'm actually going to start with you, Angela. You are the patient navigator for Robert Wood Johnson University Hospital, Somerset, and have a unique program to this part of the area. Tell me a little bit about who you are, give me a background about who you are, and what got you involved in doing this type of a program.
Okay. I originally came from Hong Kong and raised in Hong Kong, and I speak three Chinese dialects. I speak Cantonese, Mandarin, and Taishanese. 廣東話、國語、泰山話. So I have about over 15 years of experience working with the Chinese community in different aspects, social services and also, with the healthcare system. As a daughter of an immigrant family, I always get pulled into to help my family to do translation. So, when my parents need health care or go to the doctors and to see specialty doctors, they cannot speak the language. And I'm the one who have to go with them. Sometimes I have to take off from work. For example, certain kind of appointments, and then, my father would need me to go there to do translation or interpretation. Sometimes my father will not tell me that he has a doctor's appointment that he has to go. So one time I found out he has an appointment to see a heart doctor, a cardiologist, and then at that consultation, at that appointment, the doctor said, you have to go to the hospital right away. We have to do a test on you. So I asked my father, how come you didn't tell me about this? And he said, oh, because you're working. I don't want you to bother you. I don't want you to worry. So you concentrate on your work. So that's how, I feel that with the opportunity for the Chinese medical program, I got this job, and I have extensive experience working with the community, so I'm committed to this work.
It's terrific. And you were telling us before a little bit about the fact that you had started this type of a program down in Monmouth County also.
Yes. This program actually started 10 years ago at Monmouth Medical Center. So I started as one person, and just like what I start at Somerset Hospital right now. And we do a lot of community outreach, community education, because with the Chinese medical program, when we first started, people don't believe it. People didn't believe that, wow, you have someone who would go with you to doctor's appointment, to arrange transportation for you when you're at the doctor's office, and you help to interpret and also fill out the new patient forms for the patient. It is a very unique program. So for the past 10 years, the Chinese medical program, 華人醫療服務 in Mandarin, or 華人醫療服務 in Cantonese, the Chinese community in New Jersey, everyone knows about this. So that's why in Somerset County right now, we have 12,000 Chinese population live in this county, and it would be a great opportunity to help people who need this kind of care.
Thank you. We'll talk more about it. Dr. Lue, tell us a little bit about yourself.
I am a breast surgeon and the medical director of the Steeplechase Cancer Center Breast Program, the Sanofi U.S. Breast Program at the Steeplechase Cancer Center, and I've worked with Angela directly with patients in the breast program. I think what you mentioned earlier and emphasized this point is that due to cultural and language barriers, a lot of the Chinese community underuses the preventative and screening services that the healthcare system offers. And Angela really helps overcome that barrier to access, I think, to the healthcare system. And within our system, Angela has helped patients. A lot of the Chinese women don't use the screening mammogram program that is so critical for early detection of breast cancer, for example. But Angela really helps these women get into the breast center. She'll help them fill out the forms. She'll help them get their mammograms. And if there's a problem, she actually helps explain what's going on as well and get them in to see physicians such as me and other doctors within our system.
Now, as we've talked about, the Chinese American community has some cancers and other type of diseases that are more prevalent than the Caucasian population.
Yeah, I think all GI cancers are more prevalent in the Chinese community. Right. There's a higher rate of hepatitis B, for example, which leads to liver disease, liver hepatomas, which leads to eventually to higher rate of liver cancers. There's colorectal cancers, nasopharyngeal cancers, as well as lung cancer in the Chinese community, right? Yes. Related to smoking. Even though there have been very successful anti-smoking programs throughout the state, the Chinese community remains one of the places where smoking still is quite prevalent.
Right. It's really difficult to get them to come to do the testing and also for them to quit smoking. One time we did a community outreach event. We had our information, listed out, for quit smoking. And when you talk to people, they said, I've been smoking for so long and do not tell me to quit. So they are very reluctant to change the kind of behavior they've been, doing. And that's why I think education, more awareness of, different kind of, health issues is so important to reach out to the community.
Well, it goes back to the diversity of Somerset County, the fact that there are lots of cultures, and every culture does have some things that are prevalent to it, some things that are not. And the big problem that we have in Somerset County is that prior to this program, there really was no place for the Chinese American patient to actually gain some access to reduce the barriers of their care.
Right, yeah, exactly. So right now, since they know about the program, so what I do is, because I'm very new to this, to Somerset County, the first thing I was doing is I reach out to the, senior population, because they are the one needs that kind of care. And as I mentioned with my father, they don't want to bother their adult children. So they would not tell their, health issues or what they need to see a specialty doctor to their children. So I reach out to the senior center. We do tell them about the services, how we can do it, because what the Chinese medical program helping them is like a one-stop service. We would arrange transportation to pick them up from the, wherever they are, and then to go to see the doctor. When they are at the doctor's office, I will be there and to help them and communicate with the family member. So in a way, the family member don't have to worry about their senior adult health issue because it's taken care of. We also communicate with the family. Dr. Lue will, talk about it. I will translate over the phone, so they, have a very peace of mind.
So you're the way that they can get to start to get into it. You're the, as they call the patient, navigator.
Right.
You're the one that they get in touch with, and then when they call you, what does the process involve?
Oh, the process is very simple.
And you may want to also tell people in Mandarin and Cantonese also who are listening also.
Okay, all right. So maybe I start with Mandarin. 如果你们需要我的服务的话，这个华人医疗服务非常简单，你可以打电话来，我的电话是908-442-9608。打电话来的时候很简单，我需要你的名字、你的保险，你是哪一个保险，而且呢，你需要看哪一科的医生，然后我会帮你安排看医生。Basically, it's very simple. A phone call, you just need to call me and let me know your name, where you live, what kind of health insurance you have, and what kind of doctor, specialty doctor you need to see. Then I will set up the appointment for you, and then we'll let you know, or you let your family know, a family member know when the appointment is and what time the transportation will pick you up if you need transportation. And then, when you come to the hospital, I will be waiting for you in front of the hospital. So there won't be any kind of gap in between the services. And for example, if the car service or the transportation pick you up that don't speak your language, and I will right now everyone has the cell phone. I will talk with you over on the phone and make sure that you arrive at the hospital or the specialty doctor's office safely.
Yeah, I think that's kind of key. Angela doesn't, she stays with the patient through each stage of the process. So eliminating some of the fear and some of the apprehension of the process itself. Not only does she help explain things to them along the way, she's kind of there in case they have questions, they have any concerns, they have additional information they want to add, medical information, I remember as patients adding. So she's their lifeline.
Yeah, lifeline. It's really important because navigation is different from interpretation, because sometimes when I go to a specialty doctor's office and they say, oh, the interpreter is here. So it's not, because the interpreter, their main job just translate. But this navigation is you are there, you understand the feeling, the apathy, the fear is so important.
Yeah, Angela is longitudinal with the patient from the start to the end of the process. She's not just there for one part of the process, such as an interpreter might be. Yeah. She really is a true sense of a navigator. We have a few patients that I've worked with, and she stays with the patient, she follows up at all stages and steps of it. I think that's the key thing, is that Angela, as a navigator with her background, has a sensitivity for the cultural differences that prevent the Chinese Americans from accessing our screening resources, for example. That's the really big barrier. And like you said, they don't want to bother people. That's a very cultural, sensitive thing. So they'll let things go longer. The downside of that is that I'll see Chinese American females with later stage breast cancer, okay, where they've missed the opportunity for cure, right, because they didn't take advantage of the early screening things that were available to them because of fear, right, these barriers to access. I think our program is really unique to have Angela here, who really understands both the medical side as well as the cultural side of things, so she can help patients optimally. Yeah.
That's not only even the cultural side, but you speak 3 different dialects of Chinese also, and each dialect also is slightly culturally different than the other dialect, and therefore their background is going to be different also. And if I just call up the number and ask for a Chinese translator, it may not be the right dialect. Well, instead, when you get in there, it's not only the translation, it's what the transmission of the translation is.
Exactly. Another thing I do is, for example, when I work with Dr. Lue, and there's certain instructions, for example, if a patient needs to come to do certain kind of screenings, or they have to, or after they do a diagnostic testing, what kind of care, aftercare they need to do. In addition to let them know what they need to do, and I will translate the document into Chinese, and so that they have something in hand every little step what they need to do when they go home. What I found out was when patient they discharge from the hospital, when the nurse tell them this is what you need to do when you go home, it's very overwhelming because at that time the patient they want to do is let me go home and go back to my own home, sleep in my own bed. So the instruction may not be that clear to them. So to add onto that and also to make sure that they know what to do when they go home. So I will translate all the instructions and then into Chinese, and so that when they go home, they know what exactly they do.
When a Caucasian is discharged from the hospital, it's hard enough. And then add the culture and the language on top of it.
And the nuances of each dialect. Right?
And the fact, again, the nice thing with you coming into the office and being able to not only translate, but transmit the information. When Dr. Lue is telling the person what's going on, you're not just telling them this is what's going on. If the person has a question, you're able then to ask her back a question, and you're able to actually conduct a whole dialect with her. Which will also improve their care, will improve the fact that they got good care and they're very happy with the care they're receiving at Robert Wood Johnson Somerset Medical Center, and therefore will also ask maybe some of their family to come in for screenings.
Exactly, and then it's also word of mouth. They will refer their friends or family member to come because for our Chinese culture, a family. We are like a family oriented
well, the center
population.
of everything is the family.
Right. So if a family member like experience this good service, they will tell other people. I have so many patients tell me, oh, I gave your number to this like a person. Did they call you? I want them to get the good services that they have.
I think our goal is to tear down some of these barriers to good care. Which are available to the non-Chinese. It's available to everybody, but the Chinese American population does not take advantage of these services like they should. And Angela helps, drop those barriers to access.
But we have some of the best physicians and some of the best medical care here, both at Robert Wood Johnson Somerset and New Brunswick. And what we're trying to do is allow the Chinese American to access that same type of care, receive the same type of excellent care. And again, it starts from the top of the people who run the hospital. They understand there is a diversity to the population, and one of the populations we're missing is the Chinese American. A lot of the elderly Chinese Americans still speak the old languages and haven't, they're not as fluent with the American language. So what we're doing is we'd like to break that barrier down, give them that care, let them see, get their screening test done, let them follow up with Dr. Lue if necessary, and understand what their care is.
Exactly. In addition to that, this program is not just helping the senior adults. For the people who speak English, but sometimes when they go for medical appointment, it's scary. So we are also helping. I also get calls from people, they been in this country for a long time. They speak English. They have, good profession. They also said, "Can you help me? I need to find a good, a breast surgeon. I need to find a good specialty doctor. Can you recommend to me?" So I also reach out to the mainstream Chinese American population. So this program is really, really unique because we have the best doctors, in the whole healthcare system, and I really want them to get the best care.
So if a Chinese American wanted to get in touch with you, how do they get in touch with you?
They can call the Chinese Medical Program direct line. It's 908-442-9608.
Now, do you want to translate those into the languages also?
All right, I'm going to translate into Cantonese and Mandarin.
Okay.
廣東話嚇就華人醫療服務，我叫李安琪，我嘅電話係908-442-9608。我是李安琪，華人醫療服務，我的電話是908-442-9608。
And the other thing someone's going to want to know is there any cost to it?
No cost. Everything is free.
Did you hear that? Everything is free.
free for everybody.
I think the message we want to send is that, the Robert Wood Johnson Barnabas system is here for the Chinese American patient.
Exactly.
Well, it's here for everyone.
Yeah.
But what we're doing is we understand there are cultural differences. We've heard all in the past about the fact that they do things for veterans at the hospital. There's special veteran spaces for the people for that. And now what we found out is that the heads of the Robert Wood Johnson and Barnabas Health have found out that it's important that we go the next step. The next step is that the Chinese Americans, especially in the Somerset County area, are not accessing the excellent screening care that we have at the hospital, and that there are barriers, and that what we need to do is we need to break those barriers down, and what you are doing is helping to break those barriers down.
Thank you. One patient at a time.
Yep.
And one patient at a time. And the fact is that you started from the beginning and go all the way through it.
Yes.
So a person calls you and you start the process. Tell us about the process.
So the process is, when I also, set up, when they call me, and then I will help them according to the insurance and match it up with a specialty doctor they want to see. Then, I go with the patient, whatever, they need to go to see. One thing I want to mention is, for example, if some of the patients, they get the script, a referral from their doctor, what I will do is I will help them to set up appointments at the hospital. Sometimes a patient may need blood work, may need to do mammogram, DEXA scan. What I can do is I can arrange an appointment for them in one day without for them to go back and forth for 3 different days. I remember I have one patient, we scheduled 5 appointments for this patient in one day, because we want to help them to save time so that they don't have to get off from work or to cause any inconvenience. So their record will go back to the doctor who ordered the testing. I will be there with them. As a matter of fact, sometimes if a patient needs to come to do surgery, whatever time that they schedule for the surgery, I will go with the patient. I'll be there waiting for the patient. So there were 3 occasions, and I have to go to the hospital 5:30 in the morning.
You
with
are
the
an
patient.
angel.
I was
She
there.
was there in the recovery room with our patients. So when they wake up and they're scared and there's a language barrier, that Angela's there to help them. She's there to be their lifeline.
I put their shoes in my thinking. So if I were them, I want to have somebody with me and know the system, go through the system.
Now, I'm sure you're doing community outreach also.
Yes.
So what are you doing?
So what we do is we, as I mentioned, like to the senior center, we also organize, health talks, diabetes, cancer services, and any kind of health talks, and then we reach out to the community. And we also work with, community groups, in Somerset County. We also participate in health fair, in any kind of the events. We set up tables and then to let people know about what services we provide. We also, every week, we advertise in the Chinese newspaper. We have 1, 2, 3 Chinese newspaper. We have advertisement is with the Monmouth Medical Center. Now we call the Chinese medical program, we call it regional program. So in addition to Monmouth Medical Center, Somerset Hospital, we also have 2 other hospitals within the Robert Wood Johnson Barnabas health system. They also have the Chinese medical program.
Well, it's absolutely wonderful what you're doing. Now, do you also, if they call up looking for primary care, are you involved in that also?
Yes, yes.
because again, the whole center of care is starting with the primary, and again, when they get to a primary care's office, all the forms that need to be filled out, if they're not translating correctly, really will interfere with and be a barrier to what they're doing.
Yes, this is like all kinds of referral. I will help them, to schedule the appointment.
And then I'm sure you do some, if unfortunately if we have to deal with hospice, you probably deal with that also.
Right now, so far I didn't deal with hospice, but in my, prior job, I did with hospice, like.
And again, a lot of cultural barriers when people are getting closer to the time of death, probably something we need to start looking at also.
Yes. It is very difficult to explain to the family, and also I think awareness and education is very important for the community to know that sometimes we need to prepare for that. The best way to do is have an expert, have the, to come and help to work as a group, and so that your loved one will have the best care.
Well, you really are an important part of the team for the Chinese American community. You bring a lot to the table. We bring the education to the table, we bring the expertise to the table, but if we can't translate that expertise
if we can't reach the community,
then we're missing out on something that's so vital to Somerset County and to the Chinese American community.
Yes, to the wellness of the Chinese American community.
I'm willing to accept any kind of challenge or new health care that they need. I'm ready for that.
Thank you both for being here at the show.
Thank you, Dr. Ashinsky.
This concludes today's episode of Robert Wood Johnson University Hospital's Health Talk. Please remember that the opinions expressed here today by our medical experts are not a substitute for medical advice from your own physician. If you need a physician, please call us at 1-888-MD-RWJUH. For more information about the Chinese medical program at Robert Wood Johnson University Hospital, Somerset, please visit us at www.rwjbh.org/Somerset or call 908-595-2322. Now, do you want to say anything in either Mandarin or Cantonese just to follow up?
希望大家能够再打电话来我是李安琪华人医疗服务，我的电话是908-442-9608，谢谢大家。
Thank you. And thank you.